Hi guys, I'm so excited to be starting this YouTube channel, Your Labor Nurse. My name is Larissa and I'm a current labor and delivery nurse as well as postpartum nurse in a Central Illinois hospital. I've been working for about a year and I also started my doctorate towards a women's healthcare nurse practitioner and a certified nurse midwife. Not sure when I'll graduate and get those things, but I am in the process of attending school. So I started this channel because as I've started my career as a nurse, I've started to notice that one of the hardest things is when a woman comes in and they are anxious because they just don't feel like they know what to expect and what's going on, or they come in with these expectations or labor plans and those things change, or they don't look like what they thought they would look like because their friend or their mom or their aunt told them that it looked this way. And I really want women to feel informed so that they know what a nurse is looking for and why a nurse is doing this and why we like to do skin to skin and why we really push breastfeeding over formula, but why it's okay to do one versus the other, why we do certain tests during pregnancy, why we ask women to come in when their water breaks, just things like that that sometimes I feel like the OB appointments can be rushed. And so this is a way for me to just educate you and fill you in on things that maybe you were unaware of. By no means is this medical advice, though. I have to give that disclaimer. I'm not a doctor. I really just want to educate you. So to give you that knowledge and the science behind certain things in a way that I can talk to you like I'm your friend. I'm really excited. I plan to put lots of content out there about literally every process of your admission, inductions, why people might schedule inductions, all the way through vaginal deliveries and prepping for that, and C-sections and things that happen after delivery, and things like postpartum hemorrhage and what that means. So just lots of things so that you don't have to say, why are you pushing on my belly? Or I heard this is awful, to understand why a labor nurse pushes on your belly and why that's important. Just so you can feel more comfortable. Often women talk about their birth experiences as traumatic. And I really think that while there are women who have traumatic births, I think a lot of it is related to their expectations. And because it didn't look like that, it becomes a traumatic experience because they are overwhelmed and they aren't able to be educated or receive that information at that time. I can only imagine a woman who is coming in to have her first baby, the baby's delivered, the baby doesn't transition well, and maybe the mom's bleeding a little bit more. So not only have you delivered a baby and you're feeling overwhelmed and it's your first experience, now people are pushing on your belly and you're not holding your baby. So again, it can be a lot for a woman. And so I want you to feel informed so that at least your default can be, oh yeah, that lady in that video talked about this and that, and I understand a little bit of why maybe they're doing what they're doing. In the healthcare, a lot of times we forget to educate while we're doing our interventions. And that can be really scary to a mom when we come in and we're moving so quickly because our priority is to fix the problem versus educate the patient. And so this is my way of trying to do so before. I'm really excited. I hope to put lots of content out there just for you new mamas and those of you who maybe just want to feel more informed for your second or third or fourth kiddo. I'll be filming in my nursery. We are not pregnant and we do not have kids yet, but we're pursuing foster care. So we have a little nursery all set up ready to go for a kiddo. So I thought it was a perfect setting to be talking about mamas and babies. So I'm excited to start this journey with you and to share as much content as possible. I'll be throwing in some science in there, as well as just talking about personal experiences, obviously without naming names, but so that you can kind of understand all the different spectrums of birth and how they can look different, but how it's beautiful. Just a woman being able to have a kiddo and put that baby skin to skin with you and to just connect and have that euphoric moment of, this is my kid, this is a kiddo that I delivered, and this is a kiddo that I get to raise and teach about the world. So excited to start this journey with you guys, and I really hope that this is helpful and beneficial.